name is Ricardo Rodriguez from cosmeticsearch.net. Isn't it heartbreaking to listen to the pure voice of Michael Jackson as a child? You know, by the end of his life, he could barely sing, and some rumors have it that it was because he couldn't breathe right. Someone even speculated that he had a rare lung condition. I think the answer is more obvious. His nose, as many people have said, had collapsed after too many surgeries. Well, how does a nose collapse? What does the word collapse nose mean? Well, look at the picture on the upper left. The supporting structures of the main body of the nose are the septum cartilage and the nasal bones. The supporting structures at the nostrils, where the air comes in, are the septum and the lower lateral cartilages. The supporting framework of the nose, when viewed from below, is shaped like a triangle, seen as a light blue shaded triangle on the upper left-hand corner picture. In the center illustration, you see the septum in white and the supporting lateral cartilages in blue. When the septum collapses, whether it be from disease or accident, the skin of the nose and the lateral cartilages collapse as well. The nose, viewed from the side, is hollowed out in the middle like a saddle, and that's why it's called a saddle nose deformity. The patient on the upper right-hand corner has had the entire septum collapse. This patient had leprosy. The patient on the lower right just has had part of the septum collapse, and it does look like a saddle. In Michael Jackson's case, the septum may have been affected, but it did not collapse. He did not have a saddle nose deformity. If anything, his septum looks too straight, too thin, and too high for an African American. Maybe a graft was used to support the nose, but I would be guessing if I said so. What I really think happened in Michael Jackson's case is called internal nasal valve collapse. The lower lateral cartilage has a curved shape to keep the nostril open, and when you thin it too much, it can buckle at the tip where the lower lateral cartilage and the upper lateral cartilage meet the septum. This acts like a valve, and when it buckles, it is hard for air to go through, and as you try to breathe harder, it collapses even more. In this film, you can see how the nostril collapses when the patient tries to breathe in. That is because as air travels faster, the pressure inside the nostril is reduced relative to the outside, and the nostril wall is sucked in. Michael Jackson had internal nasal valve collapse. For a singer, this creates real problems. It forces you to be a mouth breather. The air doesn't get properly warmed and moisturized, and this can lead to chronic irritation of the throat and lungs. As you can see in this series of photos, looking for a perfect nose, Michael ended up with a scarred nose that interfered with his artistic obligations. There's an old saying that plastic surgery is the uneasy marriage between beauty and oxygen supply. In the end, Michael Jackson got neither, and that is a cautionary tale for those who want perfection in their surgical results. Thank you for listening.